So we've already given you a lot of the really good reasons why naloxone should not be, given arbitrarily as take-home treatment. So right now we're just going to address a couple of the points that were brought up. So one of the main points was that programs similar to this already exist. Examples include needle exchange and buprenorphine. And, for the most part, all of us usually support needle exchange and buprenorphine. But the thing with that is that buprenorphine is like to wean you off to prevent withdrawal symptoms. And in cases like this, these people have already made a commitment to start getting off the drugs. And they're trying to use that to help facilitate versus trying to counteract what they do to prevent themselves from immediate danger. So it's a process. It's not something that's going to work right away. Also with needle exchange, the point of needle exchange is not to counteract any immediate effects by what you're doing. It's a preventative measure for secondary effects. And one of the things you'll notice with this is that it's really a public health policy issue where if there's needle exchanges and diseases like hepatitis and HIV being spread, it's a public health issue. Versus overdosing is not a public health issue, it's an individual health issue. So those are two of the points that were presented that really have some fallacies of logic.
Next.
Also, they were mentioning the cost. They said the cost is really going to be low. It was only about $1 injection or whatever they said, but they also indicated that there was going to be some training. I'm sure the trainers aren't going to exactly do this for free, and to set up training facilities or however you want to do it, it's still going to cost more money. It's not just the drug itself, because then you got to manufacture more of it as well. So it's still a big process. It's not a matter of just $1 here, $1 there. So that was something they should address.
And also, we'll talk about. I think they mentioned that Narcan is supposedly a cure for overdose, but Narcan can cause such harsh withdrawal symptoms that users are forced to use again and can even use greater amounts to counteract their withdrawal symptoms, causing them to overdose again, and that time they probably won't have another dose of Narcan to use. So it's kind of a vicious cycle, and heroin users are usually trying to get that high at all times. It's kind of a vicious cycle to kind of reach that high, and naloxone only kind of brings them down for a little bit until they decide to use again, which could be pretty immediate.
Well, there's just a few things we noticed. Thanks for listening.
All right, first, they compared it to Plan B, and that's kind of comparing like naloxone's life-saving and Plan B isn't life-saving, and that's $50 compared to $1. So that argument should be thrown out.
We still have 2 minutes.
They also mentioned that having naloxone might make them inject more. There's actually no documentation that users inject more because they have naloxone. That's from a 2005 article in the Journal of Urban Health. They also said that heroin users aren't social and they need someone else there. And most deaths actually occur with the company of other people. So there are people available to inject naloxone.
Is it source or personal experience?
2007 Annals Emergency of Medicine. So, yes.
All right, the other group mentioned something about going to the emergency department to get this injected. As it stands right now, the majority of cases, majority mortality rates are due to people not calling the 911 because they're afraid, and that's why most of them die. So we believe that take-home Narcan would, help people survive. They'll live. And then another thing that you said about the mom off the street, the $1 thing. Let me put you in a situation where if you were walking by and your mother was on the floor in her vomit, would you then spend $1 to inject that Narcan?
What would it would use?
So I mean, that $1 really isn't that much.
Yeah. And in fact, you brought up the issue of that it's just another $1. It's we've already got enough costs. But from 2002 to 2009, there was an increase in the number of publicly funded substance abuse programs from 45,000 to 138,000. So I don't know what the associated cost is with that, but that's over a 3 times increase in publicly funded substance abuse programs. So I mean, you know, $1 per injection. I mean, the overall cost, it's a drop in the bucket, really. And you guys also mentioned the side effects of naloxone being like awful and horrible, and it's not so benign. I mean, yeah, but it's, you know, it's better than death. And you also mentioned some of the risks associated with possibly driving with it. But I mean, most people who are abusing heroin aren't really out joyriding in their cars while they're shooting up.
Yes.
A source?
Personal experience. Yeah.
A study in the Journal of Urban Health that looked at a small population in San Francisco showed that only 30% of people who were given take-home naloxone, only 30% had stable housing. The rest, like 50% of the people, were homeless. 20% of the people like bounced around. And yeah, you also talked about gave the case of the pharmacist screwing up something as simple as a flu shot, and how are we expecting someone who's high on heroin to be able to handle the job? But I mean, society already trusts, you know, other people to administer CPR or other emergency rescue. I don't want to say. It's just, I mean, like CPR is already really common in our society. I mean, it's an emergency measure, so you know, it's better than doing nothing. Or you know, we give patients take home like rectal diazepam to administer in the case of emergency.
The same thing.
Of having a seizure?
Well, I'm just saying you're not giving them enough credit that somehow like they'd be unable to do this, even though they may shoot up,
more credit.
you know,
Versus
5
mothers
times a
trying to
day.
prevent seizures in their children.
Well, maybe that wasn't the best example, but yeah.
Whose dad is epileptic?
The fact is, normal, regular people do all sorts of emergency interventions every
I
day,
think you'd be
and
surprised,
administering
Rob.
Narcan would be no difference.
Let them have their turn.
And then just lastly, you brought up the issue of...
Yeah, it's all done.
Okay.
We still have 2 minutes,
Oh,
right?
you just brought up the issue of the cost of training these people, and are they really going to do it for free? I mean, in most of the studies that I read about these pilot programs, all the people who were participating in it were essentially doing it for free. I mean, it's like any other free clinic who provides these kind of services. So,
Thank you very much.
I know.
Good game?
Sorry for your loss, guys. Good try.